Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power. Hello, I'm Dr. Warren, and today I want to go through what happens if you don't treat Lyme disease. And this is a question that I get kind of frequently about timing and how it looks over time. And so we're going to go through how Lyme disease looks initially and what it can look like if you don't do anything about it and how that plays out over time. First off, Lyme disease, like so many other things, if you find it early, is much easier to get rid of. So if we get it initially, if we find it initially, the standard 2 to 4 weeks of antibiotics can be very effective. If we find it later, it's not as effective. So it's important to know what it looks like at the beginning, especially as I'm recording this. It's April, May, it's warming up, and people are spending more time outside. They're going to be hiking, walking. I'm already mountain biking. And so as you're active, you need to be aware of ticks and what this looks like initially. For most people, it looks like some kind of a summer flu. And you can feel nauseous, you can feel achy, you can feel feverish and fatigued. And often we're looking for that hallmark rash that you get at the site of a bite, and it can look like a bullseye. So if you're spending some time outdoors and you get what's considered to be kind of a summer flu-like illness, it may be Lyme disease, and if you get proper treatment with medication initially, it can be very, very good. We also have an acute bit bundle that we recommend you take for nutritional support right alongside that. If you know you got bit very recently, you're recently out doing outdoor activity, or you found a tick on you and see the bite. Now, once we get past that initial illness, the Lyme disease morphs and become more chronic. And often this happens weeks to months after the bite. And for some people, this can be up to a year after the bite, where the Lyme causes more chronic problems. So here we're looking for not just a local rash, but you're getting more of a systemic body-wide rash in either bigger or multiple locations. Also, we get joint aches and pains all over the body. Lyme particularly likes knees, so you can get knee swelling or back aches or headaches, but you get more pain and more joint or muscle pain can cause both. Another presentation of Lyme as it's going chronic is it goes into the neurological system. So you get pain, burning neuropathies, you can get some central nervous system nerve problems, and you can get all these different cranial nerve involvements. You can get pain in the face or Bell's palsy in the face. But you're looking for mainly a systemic rash, body pain, or weird neurological symptoms, always accompanied by some kind of a fatigue. And then we also, in some people, can get cardiac involvement. So we can get abnormal heartbeats, we can get POTS, and we can get other symptoms that feel like it's in the cardiovascular system. It's more rare than the nerve or the joints, but it certainly can happen. So if we're getting anything in this joint pain, nerve symptoms, hearts, rashes that seem more difficult to pin down, especially if you go see that doctor and they're a little confused by it, then Lyme disease starts to rise on the probability of it being the cause. Now this, as we said, can happen fairly quickly within a couple weeks to maybe a month of being bit. For many people, this slowly grows over time. I talked to someone this morning who got the initial Lyme disease bite. They can now pin it back to a specific time last summer, and then it was a couple months later in the fall that they started to notice the joints and stuff weren't right, and then by 6 months later they're having these myriad of symptoms. So in that case, a very classic example, if the Lyme is not treated, it kind of grows for most people in the symptoms. For maybe the first year, it tends to keep escalating in symptoms. One question that I get is, when is it too late to treat Lyme disease, or when is it too late for me? I'll answer this in a couple different time frames. What I have seen and what I think the research shows is that antibiotics in the first 30 days are very effective, and a very short course of antibiotics work fairly well, 2 to 4 weeks. Now, once you're about 60 days in, Tulane came out with a study where we were doing antibiotic therapies but waiting 60 days on different mice to give them the antibiotics, by 60 days this is becoming much more resistant. And certainly we say it's gone through that early disseminated phase into more the chronic phase, somewhere between 2 to 6 months. You have this early stage which we know lasts a month, and then it's starting to go systemic once you're outside of that 30-day window. Some doctors say 2 months, some doctors say 3 months, some doctors say 6 months. But the longer it goes on, the harder it is to get rid of. So if we find it 6 months in, that's harder than 1 month in, but it's usually not as hard as 6 years in. So the longer you have it, years to decades, the deeper it's embedded itself into your system, the longer and more difficult it can be to dig it out, but you still can dig it out. It is never too late. You are never doomed. You can heal, you can fight this, and you can live a healthy life. I cannot emphasize that strong enough. No matter how long you think you've had it. I have had patients who've had it for decades that have healed and recovered. But it's better, it's usually smoother, and it's quicker, usually, the faster you find it. Another question I get is, how long does Lyme last if it's unaddressed? And the answer is forever. If you don't address Lyme, it can go on in perpetuity. Now, that does not mean everyone who gets bit by a tick has chronic Lyme disease. We think about 80% of people who get Lyme disease just get sick and get over it. But for the 20-ish% of people who have chronic Lyme, or what's called post-treatment Lyme, once you're in that category, it does not normally spontaneously resolve. And so if you still have symptoms 6 months or a year later, it's probably going to keep going for the next 5-10 years until you do something to change it. One thing that can be confusing for patients in the short run is Lyme is a disease that has these flares. And so your symptoms that you're experiencing can go up and down and can move around a lot. And so sometimes it does take time for doctors to pin down this is really coming from Lyme, because the symptoms come and go and move. So migrating joint pain that seems to move around, you still have good and bad days. Energy, good and bad days. Neurological symptoms, good and bad days. And so sometimes it takes someone a little bit of time to realize the pattern because it feels sporadic in the short term. And so that's one of the things that can make Lyme confusing for people, is it starts to flare up and down as the bug goes through different life cycles. And this makes it harder to diagnose sometimes in the short run, because people think they're getting better and then it comes back and then they're bad again, but then it's a different symptom, and then it gets better and then it gets bad again. But it can be the joint pain one time, and then it's a different joint, and then it's the fatigue, and then it's the flu-like icky feeling, then it's some nerve problems, then it's the joint pain again. And so because it can, in some people, kind of move around a lot, it can be very confusing as you starting to go to doctors. That's why we once again emphasize very accurate, thorough testing. This testing really needs to be updated. The standard test you get at the doctor is 30 years old. We have other articles on that. But it's why if we are struggling or suspicious of struggling with Lyme, when it can be this kind of up and down thing, accurate testing can really help you pinpoint if this is the right thing for you to be chasing for you to become healthy. So to reiterate our talk here, in the beginning weeks of the infection, you're looking for a bullseye rash, you're looking for a flu-like illness, you're looking for fatigue, aches, pains, mood problems, but normal flu-like icky feeling, particularly in that summer flu, spring, summer, fall flu, as opposed to one in the winter. And then chronically, after you have the exposure, we're looking usually 1 month to 12 months after you're developing more chronic symptoms. So this is unexplained cardiovascular symptoms you've never had before, body-wide rashes, more pain than you've had before, joint pain, muscle pain, headaches, neck aches, these kinds of things. And then lastly, abnormal neurological symptoms. These can be both central, where you're getting dizzy feelings or you're getting face problems, and they can be peripheral, where you're getting burning, tingling, buzzing, weakness in the extremities or in your arms and legs. Any of these things happening and we're having a hard time finding an easy response or an easy cause, then Lyme disease starts to bump up the list of probabilities that Lyme can be causing this for you. If you're struggling with a health problem and wondering if it could be coming from Lyme disease, that's where we really recommend getting that thorough testing, reaching out to our clinic, setting up that free consult with our team member that help go through some of these and see if we think it's highly probable that running that testing, investing in that testing would be worth it for you. Because if you know what you're fighting, then you can get better. You can heal. You can come up with a logical plan. But if you're fighting a ghost, you don't know what you're fighting, it's hard to fight something when you don't have it pinned down for what it is. I'm Dr. Warren. I hope you found the stages of Lyme disease useful. And if you're wondering if you're in one of those stages, we highly recommend you go get that testing.